Hello, everyone, and welcome to our Genie Product-to-Practice webinar. And thank you all for being here today. I'd like to begin today by acknowledging the traditional custodians of the land on which we stand. And for me, I'm based in Brisbane, so that is the Turrbal people and the Yuggera people. And I would also like to pay my respects to elders past, present, and emerging. My name is Niamh Tobin, and I'm the General Manager of Product for Practice Management and Oncology. And today we'll also have speaking Sachandra, who's been the Product Manager of Genie for the past 2 years. And we're also going to have Lucas Arundel join us. Lucas is the General Manager for Design, UX, and Customer Research. So today, Sachandra is going to talk to you a little bit about the future of Genie. And we'll also talk you through what has happened recently, what has been released recently for Genie, and what you guys can expect to see coming soon with respect to new functionality in Genie. I'm going to share a short update about Gentu. So we're conscious that many of you may be considering a move to the cloud, and we want to help you understand where Gentu is up to. And then at the end of the session, Lucas will finish by providing you with an overview of the Genie Craft Group. So this is the group of people that we work alongside to help improve the experiences for users in Genie. So our session today is going to be recorded. And we'll add it to our YouTube playlist towards the end of the week. And it's also going to be sent out via email to all Genie customers. At the end of the session today, we will have a live Q&A. So please add any questions that you have or that come up throughout the presentation into the Q&A box. We'll actually do our best to answer as many of them as we can as we go. But then what we'll do at the end is we'll call out any of the themes and we'll answer them live, or maybe perhaps answer any of the ones that we haven't had a chance to get to throughout the session. Now, before I hand over to Sachandra, I do just want to take a minute talking about our platform vision, as this is how we see ourselves helping you, the medical professionals, deliver better healthcare outcomes over the coming years. And our practice management systems vision is really centered around a technology platform that's going to enable us to provide you with new product innovations into the future. So some of these product innovations we will build ourselves, but also some of them will be provided through integrations with third-party products. Now, the innovations that we have been and will be working on have really been targeted towards 3 objectives. So the first is improving the patient experience, but by providing you with tools to automate the patient journey. And this is things like online booking experiences, patient registration forms, digital patient payments. And the end goal here is that we can help practices be more efficient in how they support patients through their journey. The second objective is connecting up what is a very disconnected healthcare ecosystem today. So we know that many of you interact regularly with pathology labs, radiology labs, private hospital groups, and you don't often have the information that you need at the point of care with the patient. And so we want to not only support safe and secure sharing of data with these parts of your healthcare ecosystem, but we also want to enable real-time collaboration between yourselves and the other parts of your ecosystem as well. And the third objective for us is to bring data-driven insights into your workflow. So we know that there is often unstructured data that sits in letters or clinical notes within Genie that can sometimes be hard to access or can be hard to query and understand what insights might exist within that data to help us deliver more practice efficiencies or better clinical outcomes for patients. So something that we have been working on, and Sachandra will talk about a little bit in a bit more detail shortly, is helping to structure that unstructured data and then surface up insights back to medical professionals to help them make better, more informed decisions. But all of those objectives also sit alongside Genie and Gentu, which are obviously our core practice management software solutions, and continuing to uplift and improve the workflow and the experiences within those tools. So helping you to book and manage appointments, bill for services, and obviously record notes for clinical consultations and things like that. So look, now I'm going to hand over to Sachandra. And as I said, Sachandra will talk to you a little bit first about the future of Genie, and then she'll get into the details of, you know, what's happened recently for Genie and what you can expect to see coming soon. Over to you, Sachandra.
Thanks, Neve, and hello everyone. I'm Suchandra, the Genie Product Manager, and welcome to another exciting product update for Genie. Today, I want to start by talking about the future of Genie. We know that many practices have questions about the future of Genie and the switch from the desktop to the cloud-based software, which is Gentu, and we want to be clear about our commitments to our Genie users. Last month, you may have received an email and video message from our Managing Director, Michelle. To reiterate Michelle's message, Genie continues to be an essential part of our business with ongoing investments, and it remains a core of our products. This means Genie continues to be fully supported with dedicated resources and ongoing customer service. Nothing is changing for you, and there is no date or deadline before you have to decide to move from Genie to a cloud-based software. At the same time, we are continuing to improve and evolve our cloud-based software, Gentu, building it for the future of the healthcare. Gentu is ready when you are ready for Gentu. Whenever you are ready to learn more about Gentu, we are here to help guide you. If you want to learn more about Gentu, scan the QR code or on the screen now, and someone from our team will be in touch. In the meantime, our usual channels of communication and support for Genie remains open. Genie team is currently working towards feedback and market insights from our recent customer research conducted with GunWE and our regular customer survey feedbacks. Today, I will share some insights on what we are currently working on in response to this. If you have any questions about the future of Genie, submit them now in the Q&A box, and we will answer as many as we can towards the end of the presentation during our Q&A. So to summarize that, there is no end date for Genie, and you can stay in Genie as long as you want, and our business is committed to support you through the journey when you are ready for your move to Gen 2. Last month, we ran a really special event called Genie Connect and Co-Design for our Brisbane best practices. 6 incredible practice managers joined us for 5-hour in-person design workshop, along with our Genie product team, support team, and a few extras behind the scenes also. The goal was to better understand our practices, how they work day in and day out, co-design some ideas with them, and shape up the Genie's future with the people who use it the most. And the feedback, well, it was amazing. We received a 100% event rating, with everyone giving it a 10 out of 10 and saying they would recommend it to a colleague, which is so good to hear. This was just the beginning. We are excited to keep building with you, not just for you, and events like this will play a big part in how we shape Genie's experience going forward. And we believe this clearly shows the commitment of Magentus as a business for our Genie product. We look forward to doing more like this, so please keep an eye out for the invites. Lucas, our General Manager for Design and User Experience, will share more details in the upcoming slides. Now comes the exciting part to talk about the updates we have already delivered. These enhancements are designed to address some of the challenges you have shared, as well as introduce new features that make Genie more powerful, efficient, and aligned with the needs of our practices. Here is a look of what new and improved in Genie. All of those changes are heavily influenced by our user feedback and suggestions. We know how much you rely on Genie every single day and how important it is that it remains stable, secure, and supported, especially with all the changes in the technology around us. Technology is rapidly changing, as we know. That's why we are excited to introduce Genie version 11, a release that's all giving you confidence and peace of mind. One of the biggest changes under the hood is an upgrade to the 4D version to 20.6, the core technology that powers Genie. While this may not be something you see day in and day out, but it brings real benefits like improved performance, stronger security, and a solid foundation for the future. We have done this work to make sure Genie stays reliable, not just today, but for years to come. We have also focused on making Genie work seamlessly with the latest systems you may be upgrading to. Genie version 11 is now officially certified for Mac OS 15 Sequoia, Windows 11 24H2, and the upcoming Windows Server 2025. So no matter what your device or IT environments you're working in, you can trust that Genie is ready and supported. We know that we have been a bit behind on supporting the latest operating system, but this has been a known strategy for us that we will always try to be on top of the latest version of the technology for Genie so that we can support you with the modern hardware support. Also, for the little things that make a big difference, we have also updated the postcode data to ensure your patient information stays accurate and compliant with the current standards. We understand the postcode was not updated for some time, but now we have a process in place where we have a yearly subscription from a company which gives us latest postcode data, and we get quarterly updates for it. So this will really help us keeping the data, most up-to-date data in Genie in the coming days and months. We know that when something in Genie doesn't work quite right, it doesn't just slow down your workflow. It can cause real frustration, especially when you are in the middle of a busy day seeing patients or managing a packed schedule. That's why I want to take a moment to highlight a few important product quality updates we did in terms of security and performance that we have delivered, all based on issues raised by our users. First, we have improved how Genie performs for Windows 11 users, where part of the Genie interface didn't appear correctly when the display scaling was set above 100%. We heard how disruptive this was for visual visibility, usability, especially for high resolution monitors. And we are glad to say that this has now been resolved in the latest version of Genie. We have also improved Genie's performance for practices using terminal server environments, where only one user could authenticate with OAuth in the email module at a time. We know that email is a critical part of daily communication, and the fix ensures that multiple users can now work without those roadblocks. Improvements has also been done to database replication performance, especially when images are involved. We know that slow replication can cause major delays and impacts how data flows across your practice. So this fix should bring noticeable improvements in terms of speed and reliability. Also, a lot of improvements have been done in the product quality improvements has been done in the clinical area for Genie. We heard from our users regarding uplifting the quality of Genie around the clinical area, and we have resolved a few issues in the phototherapy module. One issue caused the phototherapy window to stay open even after closing the associated patient's clinical window, which we know could lead to confusion or clutter. That's now have been fixed. And we, as part of the fix, we have also updated the phototherapy title bar now to show only the number of records for the current patients rather than the entire database, which we understand will make the view more relevant and much easier to navigate. We have also made a meaningful update in the e-prescribing workflow. Previously, an error was occurring when trying to create e-prescription for patients whose gender was marked as I, which means intersex or intermediate, or N, not stated or inadequately described. We understand how sensitive and important this is, and we are really pleased to confirm that this issue has now been resolved, allowing for a more inclusive and reliable prescribing experience for our users. Finally, we have resolved an annoying issue in the clinical window where Genie could freeze after opening and closing a current problem or past history dialog, especially after previewing a file in the contact list. These small interruptions can really add up, and we are grateful to our users for the support and patience while we worked on those improvements. We know that how valuable everyone's time is and how much time can be lost to admin, especially when it comes to documenting consults. That's why we are really excited about the work we are doing to bring the AI scribes into Genie to help ease that burden and give you more time back for what matters most, your patients. We have partnered with now two leading AI scribe solutions that are designed to work seamlessly with Genie, Meadow and iScribe. In the last webinar, we have shown a detailed integration how Meadow works with Genie, and Meadow is now available for anyone to use. It is fully integrated and ready to use in your practice. It listens during a consult, transcribes and drafts your notes, saving you both time and mental load at the end of a long day. iScribe is currently available for our users, but it's in beta stage, and early adopters are helping them refine the experience even further. This gives a chance for iScribe to test how it performs in real practice settings and make sure it fits naturally into your existing Genie workflow before it's made available for everyone to use. These integrations are part of our broader commitment to not just maintaining Genie, but in enhancing in a way that deliver real practice value to your day. We are doing it because we believe these tools can save time, improve accuracy, and ultimately save money across the whole practice. So if you're interested in joining the iScribe beta, reach out to them, and they should be able to guide you through the process. As we have mentioned in the last webinar that native telehealth feature will no longer be available in Genie, but at the same time, we have partnered with CoView, which provides an excellent experience for users who use telehealth. With Genie's integration with CoView, your practice can now offer telehealth appointments with ease and confidence. CoView is Australia's leading telehealth platform, trusted by thousands of healthcare providers. It is highly secure, ensuring patient privacy, and is incredibly easy for patients to access. No downloads or logins required. For practices, setup is simple and can be done through the SMS automation manager in Genie. With CoView, you can maintain high quality care while giving patients the flexibility for remote consultations. The details of how to integrate with CoView are all available in your knowledge base if you want to go and have a look of how it integrates with Genie. Now that we have covered the latest updates and improvements in Genie, let's take a look at what's coming soon for Genie. I want to share an update regarding the e-prescribing version 3 conformance. So we have finished the work that is needed to make us conformant with the version 3 for e-prescribing, and now it's in testing phase with ERX. So ERX needs to do end-to-end testing of how e-prescribing version 3 works, and once the testing is done, then we can release it to our users. So now that it's in the hand of ERX, we believe that it will be done soon. And as soon as we are done with the conformance, we'll plan a release so that all our users get ample time to upgrade before the version 2 deadline is passed. So that's all looking good for us. And we hope to give you the e-prescribing version 3 soon on your way. As most of you know that currently the e-booking experience in Genie is a bit disconnected as users need to follow a separate workflow for e-bookings. With our enhanced booking integration, you can now streamline your workflow like never before. There is no double entry needed. One simple process handles both the procedure and the hospital booking in one single flow, which will save you time and will reduce errors. Even better, any updates you make to the procedure, like changing the date or time, will automatically sync with the hospital bookings. This means fewer steps and no risk of outdated information slipping through the cracks. So once the e-booking will be released, while you are using the creating a procedure, eBookings will be created for you, and no extra step is needed from the practitioners or the admin person to create a eBooking. So that's also towards the tail end of work, and we are working closely with HealthScope so that we can plan a release for our users. One of the good things that come with eBooking is the automatic status updates. So to keep everyone in the loop, you will get status updates right from your appointment book. It can, once a procedure is booked, it will wait for confirmation from the hospital. And if the hospital needs anything, it will send a status back to the practice. And if everything goes well, the hospital booking will be confirmed, and all the status will be available in real time for our practices, and the status will be available in the appointment book, in the clinical window, and also in the procedure window. So we believe that this will add a lot of value for our users, because those are all available real time, and there is no need to do manual follow-ups or chase off with the hospital to see the status of the e-bookings. We have also made it easier than ever in the upcoming Genie version to ensure patient consent is properly recorded and attached to the procedures. With the new workflow, you can directly attach a consent form to a procedure at the time of booking. You can attach it from your computer or from the patient attachments. So if the consent is already, or any document is already there in the patient attachments, you can directly attach it from the patient attachments also. This will ensure that clinical and admin staff have immediate access to the consent when they need it, whether it's for hospital admission, audits, or for the follow-up care. It also supports better compliance and reduces the risk of delays on the day of the procedure due to missing documentation. It's a simple step that adds real value to your workflow and peace of mind for your patients, we believe. We have introduced a small but yet powerful enhancement to streamline your billing workflow. You can now select the site of service directly on a procedure. And don't know whether this is where you can see in the screenshot, but if you can see, there is a site of service dropdown available directly under the provider, which you can select when you are creating a procedure. And what's even better is when you transfer a quote to an invoice from the procedure window, the selected site of service will automatically carry over to the invoice. So no need to re-enter it manually. It's one less thing to enter, and one more way Genie can simplify your day-to-day processes. So we have heard multiple times from our practices that this is one thing that needs to be improved in Genie, and we are really excited that we got the time to deliver that value to our users. As part of our upcoming regulatory changes, there is a mandatory ear vaccine conformance deadline coming up on 24th of October 2025. To meet this requirement, all clinical systems must support the accurate capturing and reporting of maternal immunization to the Australian Immunization Register. We are actively working on it now to ensure your system is fully compliant ahead of the deadline, and we'll continue to keep you informed of those updates to roll out. And as of the e-prescribing conformance, we will try to release as soon as we pass conformance, so that the practices get ample time to upgrade and start using those features. We are continuing to expand the convenience and efficiency of radiology requests. Right now, electronic requests are already available for Sonic Radiology Labs, allowing you to send requests directly from your system. No printing, no scanning, just a streamlined digital workflow. We are excited to share that this functionality is being extended to Lumos Imaging and Southeast Coast Radiology in the coming months. This means even more practices will benefit from faster processing, fewer errors, and better coordination of care with radiology providers. We understand that the way e-requests are working in Genie is not the best of experience, and we will be working and investing more time to make sure that the e-request is adding value to your practice in the coming months. We are really excited to announce that the online eligibility checking is back in the roadmap, as we have heard from a lot of practices that this will help them save time and be more efficient in their workflow. Will be a powerful feature designed to give you greater confidence during the quoting process. With just a few clicks, you can check a patient's health fund eligibility for specific item numbers before the appointment. This means you will know upfront what's covered, what we significantly reduce the chance of claim rejections later on. It also helps the patient make informed decisions and reduce those frustrations and last minute cancellation due to unexpected out-of-pocket cost. But we are thinking of integrating this step into your quoting workflow, and we expect to improve the patient experience and also protect your practice revenue and saving time on the follow-ups that we have to do for checking how much is covered for a patient based on the health fund they are holding. We heard from our users that the demographic window needs to contain some additional features and fields to cater to the modern day practice need. Users showed great interest in recording sex, gender, and pronouns for the patients so they can defer it appropriately during their consultation. So as part of that initiative, we will be renaming the gender field to sex, and we will introduce 2 new fields to record gender and pronouns. We will provide the industry default options in the drop-down to start with, but the user will have the ability to add more options if it's suitable for those practices. So once the pronouns are added, it will also be available on top of the clinical window where we see the name of the patients, so that when the practitioners are talking or the admins are talking to the patients, they know what they are appropriately to refer to the patients. So we are really excited to introduce this feature in Genie, and this will make Genie inclusive of all. We will also work on few basic features which will have high value for our users. We have heard multiple times from a user that the bin icon next to the pathology and radiology template leads user accidentally delete the templates, which cause a lot of inconvenience for our practices. And we have heard from our support team that this is one of the main reasons we get a lot of calls in our support also. So in order to remove that confusion, we will remove the bin icon from there, but the user should be able to delete it from the merge letter template section as they can do it now. Some of the users mentioned the day note section is very small, and if a lot of note is added, it's hard to read from a small section. We'll work towards making it resizable so user can manage the size of the day notes and can make the size that suits for their practice. Is not have to read from a small section of the screen. Also, currently in Genie, there is no option to search a patient by email. And we heard from our users that it will be beneficial if we can add the option to search by email for our patients. And we will working towards adding the capability in Genie soon. After the release of the SMS Automation Manager last year, we heard from our users that since now they are able to create specific templates for specific appointment type, it will be valuable to make those templates available when practices are sending the SMS manually. So it's really overwhelming for us to know that so many practices rely on sending the SMS manually. And the general feedback is that if we get those templates available, that will be super valuable for our users. So we will be working towards making those templates available when sending the SMS manually also. We are excited to announce that 3 new cardiology dashboards are coming soon to support cardiology practices in identifying and managing patients with significant cardiovascular condition. First, the ASCVD dashboard, which will help you easily track and manage patients with atherosclerotic cardiovascular diseases, bringing critical risk factors and treatment insights in one view. Next, the valve patient dashboard gives you a focused view on patients with valve disorders, helping prioritize follow-ups and also intervention planning. And finally, the HCM dashboards support the monitoring of patients with hypertrophic cardiomyopathy, so nothing can slip through the cracks. These dashboards are designed to make patient management more efficient, targeted and data-driven, giving you more time to focus on care. Apologies if I have pronounced some of the terms incorrectly. So thank you all for your time today. I'm always excited to deliver the updates to you all and hear your thoughts and feedbacks. So if you have any feedback, please feel to reach out to us directly. And now we'll hand over to Neve for Gentu update, and I will be back soon for the Q&A.
Great. Thank you, Suchandra. That was a fantastic update. So now, as I mentioned at the beginning, we know that many Genie customers who are on the call today are thinking about a move to the cloud. You know, we understand the challenge and costs that exist with running hardware locally, particularly if you work external to your main practice. And we appreciate that Gentu is going to give practices the flexibility that they need to run busy practices. So we're continuing to step up our progress on getting Gentu ready for Genie customers. Gentu is now the fastest growing cloud practice management software in Australia. And we've just tipped over 2,500 practices using Gentu, with several hundred of those being Genie customers who've migrated across to Gentu as well. A question that we keep getting asked is, is Gentu suitable for my practice? And, while there are some differences still between Genie and Gentu, we are finding that Gentu has broad suitability for a significant number of Genie practices. And so if you are considering a move to the cloud, please do reach out and have a chat with our team. We do have a cloud transition team now who can support you with understanding what you use in Genie, what is available in Gentu to meet those needs, and help you determine when is the right time for you to make the move. I guess to help with some of that decision making, what I wanted to share today was some of the recent improvements that we've been making on Gentu and what you can expect to see land in Gentu kind of between here and Christmas time. So we've been working on both admin. Oh, sorry, that jumped too. We've been working on both admin and clinical workflows, including our dedicated practitioner mobile app. And we've also had several new partners join the Gentu marketplace. Starting in the appointment book, which is captured here, there's been lots of small enhancements to drive efficiency and make sure that it's really easy to understand the status of the patient. So in the appointment list view, we've added things like the day of the week, making sure that the color, the appointment type color is actually reflected so that it's really clear the type of appointment that the patient has had. And we've also updated our appointment book printouts. So now you can print out all the appointments for a patient or just the future appointments for the patient. Something really highly requested by Genie practices who moved to Gentu was an equivalent of the memo field in Genie. So you guys will be familiar that, when you book an appointment, the memo box can pop up and provide you with important notes that you need to be aware of for that patient. We didn't previously have that in Gentu. So in Gentu, we had a function called admin notes, and we've now created the ability for those admin notes to appear when you book an appointment in Gentu or when you open up an existing appointment for the patient. So that's been really welcomed by Gentu users. The team have also been looking at streamlining referral workflows, so adding the ability to search for a referrer based on the referrer's provider number. And for multi-practitioner practices, we've also added the equivalent of the referred to field, so stating, who the referral is for, or which practitioner in the practice that the referral is for. And now that referred to has been selected, that actually flows through Gentu into things like the invoicing workflow and also into the appointment book. So when Gentu is checking for the referral status for a patient, it'll do so based on who that patient was referred to and is being booked in for an appointment with as well. So just making sure that we are accurately understanding the status of a patient's referral when we're making those appointments. Continuing in the admin workflows, the next feature, which is secure email to practitioners and third parties, actually, it's a bit broader than practitioners, has been a big hit. So we've introduced the ability to email third parties. So think practitioners, allied or other specialists, GPs, allied health practitioners, but also insurance companies and things like that. you can now email them either with a password or without a password. So we obviously are encouraging people to use a password when you're thinking about sending PHI or PII, but it is now a decision for the practice staff. We were aware that practices were needing to, save PDFs or download a letter or a document as a PDF from Gentu and attach this external to Gentu. So this has been a big time saver. Lots has also been happening in the clinical workflows. A common piece of feedback, again, from Genie customers in particular that had moved to Gentu, was the absence of quick scripts. So the ability to be able to save, those medications that you prescribe commonly in a kind of favorites list. So we've now implemented quick scripts, which allows you to quickly prescribe medications with the same details without having to enter in all of the various pieces of information each time. And while we were in this area, we also incorporated MIM's product information sheets. So we've had consumer medicine information for quite some time in Gentu, but we've now added in the product information. Also in the clinical space, we had feedback from users about the density or volume of data that was available on the screen at any one time. There was a little bit of additional scrolling required to see all of the information that you needed to for the patient. So what we've done is we've really optimized or maximized the reading space on Gentu and reduced some of the white space so that you can see more information about a patient at any one time on the Gentu clinical screen. And then we're also continuing to add breadth of letter references. So Gentu has lots of letter references. You think of all the patient demographics and basic clinical information, but we continue to add more letter references, in particular things around diagnoses and past clinical history most recently. Gentu has a mobile app, which is really dedicated towards practitioners. So users of the mobile app can view their appointment books, so the patients that are booked in for any given day. They can also look at patient demographic and patient clinical records. And earlier this year, we added in obstetrics workflows. Let me just hit play on this one. But most recently, what we've done is we've actually added the ability to scan documents on the mobile app. So as you can see here, you can scan, not just take pictures of documents, but actually create a scanned document and then attach that document up to the patient's file from within the mobile app. We've also improved the image capture experience. So we did have image capture in the mobile app for some time, but now Gentu mobile app allows you to capture multiple images at any one time and process those more rapidly so that they're available within the web application of Gentu very, very easily. Last October, we launched the Gentu Marketplace. Sorry, it's just wanting to play the videos now. We launched the Gentu Marketplace. And our intent with the Gentu Marketplace is that we know that practices use many other products outside of Gentu to run the practice. And so we're wanting to enable practices to connect up those products and streamline the workflows. The initial focus of the marketplace was really on transcription providers. And now we have 5 AI scribe providers connected to Gentu. The experience that exists there is that you can see your patient list in the scribe application. And then that allows you to start listening in the scribe application for that patient. And then once the letter has been created for the patient in the AI scribe, that letter is then saved back into Gentu either as a letter that you can then send out via electronic correspondence or print, or it can also be attached as a PDF to the patient's file. Earlier this year, around January or February, we launched an integration with Health Engine. So Health Engine provides an online booking experience, which allows patients to search for a book and now more recently manage their appointments online. So move or cancel their appointments as needed. Very recently, we launched a workflow with Consentic for patient registrations. So this is available for new and existing patients in your practice, where you can send the patient an SMS and get them to update their patient demographics or sign their practice consent form online. And then that information is automatically updated into the patient file within Gentu, and a copy of that document attached to the patient record for records purposes. Consentic also offer a digital procedural consent and patient education experience as well. And then two other products that are available on the Gentu marketplace is ConsultMed, which is a workflow for incoming referrals from other GPs or specialists, and CoView, which Suchandra just spoke about earlier, who provide telehealth and an experience for managing remote patient care. Coming soon to the Gentu marketplace, we have the Clinician. Now, the Clinician is a PROMS and PREMS tool, so patient-reported outcome measures and patient-reported experience measures. And then we also have Zeta and Visere, and these are AI assistant tools. So these tools can manage incoming calls to your practice, and they can respond to general inquiries, as in, where is the parking or something like that. But they can also actually help respond to and address a patient appointment inquiry. So if a patient needs to cancel their appointment or move their appointment to another day, or if they want to book an appointment, the tools, these new AI call assistants can actually make those appointments within Gentu. So we're really excited to see how these tools are going to assist practices and reduce some of the burden that exists from admin tasks that are coming in via the phones. As we look a bit further into the year for Gentu, two areas of focus for us on the marketplace are going to be clinical specialty tools and financial integrations. So for clinical specialty tools, we are now actively looking for solutions for things like pediatric growth charts, but also the other specialty modules that exist within Genie today for rheumatology, dermatology, ophthalmology, and making sure that there is a really great solution available for those in Gentu. We're also aware that many Genie customers today use Tyro for a payments experience. So as the year progresses, we will be looking to connect up with Tyro. We're also looking to connect up with accounting software packages like Xero and MyOp, and then also connect to some practice intelligence tools for deeper reporting capability for Gentu practices. So that's kind of the year ahead on those two larger kind of themes of areas for the Gentu marketplace. Now, while connecting up to products that are used in other products that are used in the practice by Gentu users today, we are also continuing to evolve the admin and the clinical workflows. So in the coming months, still looking in the appointment book, but we have been working on the equivalent of the day notes field in Genie, and also enabling users to jump ahead a number of weeks. We're finally adding the equivalent of custom forms. So this has probably been the biggest gap, I think, that remains between Genie and Gentu, where Gentu users today, they have a way of achieving this, but it's not an efficient way of achieving it, to be able to populate data that exists within Gentu onto a PDF document, to then be able to print or email that document across to a third party. So we are underway now with a PDF forms tool, which will enable users to create things like work cover certificates, Centrelink certificates, and all of those kind of things. So it'll allow them to pre-fill data from other parts or that already exists within Gentu. So that's a big one, and we're hoping to have that available between here and kind of Christmas time. And then on the clinical side, what the team is working on right now is really improving the situation for multi-practitioners. So in Gentu, we'll be enabling clinical filtering. So people will be able to filter clinical records based on the practitioner that has created those clinical records. And then a big piece of work for us that will probably be our focus between here and Christmas is the clinical window configuration. So at the moment, the clinical window in Gentu is quite static, as in what's there, you can't really move around what it is relevant to you. We're obviously conscious that specialists have different ways of working depending upon what specialty that you're in. And as a result of that, things like allergies, medications, past history is more important or not to some people. So what we're going to do is enable users to configure the clinical record so that they can move around what's relevant to them or remove maybe what's not relevant to them as well, and just optimize their clinical workflow. For those who order radiology requests, we've been working behind the scenes for a number of months now with Promedicus, who are a major delivery partner of results from radiology labs. This integration is in the final stages of testing, and we aim to be launching across a range of labs really between here and Christmas. So it is a staged process by lab brand, but we're planning on starting with North Shore Radiology and Nuclear Medicine in around September time, and then moving out to iMed, Radiology SA, and Dr. Jones and Partners as the year progresses. And then last but not least, in the Gentu mobile app, the focus is going to be on an appointment book uplift in the coming quarter. So the appointment book is by and far the most used part of the Gentu mobile app by practitioners. And so in the coming weeks, we'll be adding the ability to see non-patient events in addition to patient appointments. When we add the day notes capability into Gentu, we're also going to add this into the mobile app. And then we're also going to add the ability to see the next patient, the next appointment for a patient, and also to book new patient appointments into the mobile app when you're on the go. So many users of the mobile app use it to get ready for the day ahead. So let's say today, getting ready for the consulting day tomorrow. So we believe that the addition of the day notes and the non-patient events will really assist in helping to understand the full context of the following day, while being able to access the patient's next appointment and book an appointment will just mean that doctors can stay on top of any of those admin tasks that they need to do when they're out and about on the go. So look, I hope that has been helpful, a short but a bit of an update on Gentu and how Gentu is evolving. As I mentioned at the beginning, if you are considering a move to the cloud, please do reach out and have a chat with our team so that they can understand your needs and when might be the right time for you to make that move. I'm now going to hand over to Lucas, who will give us an update on the Craft Group.
Excellent. Thank you, Neve. And both Neve and Suchandra, thanks for those updates. It's great to see not only the things happening in Gentu, but the continued investment in Genie as well. So hi, everyone. My name is Lucas Arundel. I'm the General Manager of Design and Customer Research here at Magentus. And just here to talk briefly about how we co-design a lot of the new functionality for Genie and how we work with our customers on that as well. So first of all, why co-design? I will just check my screen is moving forward. So first of all, we believe software shouldn't be a burden to use. And at the end of the day, most of you here on the call and of your colleagues are really in healthcare to help people and not necessarily to be using software. At least at the moment, that's a byproduct of technology. But we really want to make sure that when you do have to use software, that it's something intuitive and a positive experience. The second part is that when we are actually designing Genie and Gentu, we use a process called design thinking or user-centered design. And what that really places in the center of everything we do is you. And we acknowledge that combining the expertise we have in product and technology at Magentus with the way that we can work with you really puts us in the right position to deliver the best and most innovative user experience possible. And lastly, when we are doing this kind of co-design, we often do user experience research, and that can come in a lot of different shapes and sizes. Sometimes it's one-on-one interviews, could be testing of mock-ups and prototypes, or doing beta groups as well. And we acknowledge that there's a lot of different methods to do co-design, and the way that we try to coordinate working with you is through something called the Craft Group. So the Craft Group is essentially an advisory group of Genie users who have shown interest in working with us on helping shape new features. And the way that it works is that as we're going through our process, which I'll talk to in a minute or so, we'll look to who's in the Craft Group and reach out to do things like one-on-one interviews. That's, of course, always based on your availability, but we'd reach out to get your perspective and feedback on things. Often we would do mock-ups and prototype tests that we might put in front of you if we're sharing our screen or getting you to get hands-on in some early features. And that can often play out into the beta side of things as well, where you can get early access to features as well. And many of the customers who have done this with us, they really value the fact that they get to help shape the outcome of the feature, and usually it's a great payoff because then when it lands, it's just as you'd hoped for. So in terms of how it works, then I've got a small scenario here. So as we're working through the Genie roadmap, usually we'll reach out to seek feedback on the areas that we've prioritized. That's always, as I said earlier, subject to your availability. Sometimes it's just asking for 30 or 40 minutes of your time to get some early perspective from you. As we're working through those interviews, when we are creating those mock-ups and prototypes, sometimes we might come back and say, hey, we're working on a solution now. How does this look to you? Or sometimes it's just a simple email where we said, based on our last conversation, here's what we're thinking. You want to give a quick bit of feedback or validation. And that then usually plays through into the ability to get hands-on in early access beta features to actually test it when it's the real sort of working software as well. And that's something that we see as being incredibly valuable, because it means that when we are working with our developers, we have a lot more confidence in the design, and that makes it a lot quicker for us to get value to you. So I mentioned before one-on-one interviews as one example, but there's a number of different ways we engage with customers. And Suchandra mentioned earlier one of our recent craft group events that we did here in Brisbane, the Connect and Co-Design event. That was a really engaging session. We had the 6 practice managers come and spend some time with us on a Friday afternoon. We got to have a really quick fire discussion around some of their pain points and preferences. We got the pens and paper out and actually sort of sketched what they believed to be the right solution. And our software developers were right there immediately being able to design with them. And you can see from a few of the quotes here that there was a really, really positive vibe from the group, as well as a lot for everyone, in fact, actually saying that they would recommend this kind of event. So I'm really happy to say that this is coming again in Melbourne on the 20th of October, which is around the AAPM Practice Managers event. That'll be also that week in October. So if you're interested, please, there'll be a survey at the end of this call where you can show your interest. And more broadly, if you're interested also in co-designing with us and being part of the craft group, you can also show your interest there. And lastly, I just wanted to take a moment to say thank you to any of you who may be on the call here who have participated in this with us. We know your time is busy, is limited, and that you're very busy, but we really appreciate the time that you do take with us, because in the end, it really helps us to feel both excited and confident about the value we'll deliver to you. So thank you.